we've heard a lot of people say, "Oh, it is, very life-threatening. It is a very critical situation." Of course it is, but the good thing is that also is very, very, very treatable actually. It's not a death sentence at all. And of course, we have this part of the show to educate our listeners on, the things to do. We have, a lot of things that we want to talk to you about this morning. That is why I have invited a very, very, very special person to help you. He is literally the OG, and I believe that you are going to learn a lot from this show. Good morning again, our listeners. This is 102.3. Good morning, Nos Andrew.
Good morning, Ma.
Good
Good
morning.
morning,
How are you?
listeners. I'm fine.
Okay, Nos Andrew. So we want you to tell us everything about ulcer, right? We've heard a lot of things. Some people say if you eat oil, you're going to, get ulcer if you don't eat properly. But I think there is a lot of misconception to ulcer,
Yeah.
and we need to educate our people. Right, we need to educate everyone. Everyone needs to understand how it works, the causes, because even your daily lifestyle can cause ulcer. It can trigger ulcer. So, yes, sir, good morning. Welcome officially to the show. I believe I'm really, really honored to have you here.
Good morning
Thank you
once
so
again.
much
Thank
for
you.
honoring my request. So, sir, would you tell us, everything? Like, give us a broad spectrum on what ulcer is.
Okay, let me just take away the misconception. Food generally doesn't cause ulcer,
Okay.
but there are certain foods that precipitate or trigger or aggravate the symptoms of ulcer. But food in its entirety doesn't cause ulcer. So let's take that one aside. And ulcer, basically, to a layman, ulcer is like a wound. If you have a wound out of your body, we normally refer to it as an ulcer. So it's an open sore that have break the continuity of your skin outside or inside. So basically, ulcer is a wound. It's established.
Okay.
But now, what we call peptic ulcer disease. Normally, this is a disease condition that causes open sores or ulcer that develop on the lining of the digestive tract. Because the digestive tract starts from the mouth down to the anus. So ulcer that's a wound can actually occur along that tract down to the anus. So, but majorly people understand there are majorly two ulcer that is normally treated, but that doesn't mean ulcer doesn't occur on other part of the
The
digestive
body.
tract. Yes.
Okay.
Mostly we have ulcers in the stomach that we refer to gastric ulcers, and on the duodenum. Duodenum is a bit part, that's the upper part of the small intestine. So it's called duodenum. We also have duodenal ulcer, and it forms the bulk part of the ulcer that we manage in the hospital.
Okay.
But normally on that tract, in the stomach and the duodenum, we have a mucosa lining that line the digestive tract. What it does, it helps neutralize the acids that the parietal cells of the stomach release, and the enzymes, digestive enzymes. Now, it neutralizes that. So, for that mucous lining, because it's thick, that mucosa lining is also divided into three parts, where you have the epithelia, the lamina propria, and the muscularis mucosa. So that lining, before it is eroded and causes open sore, that means it must have undergone so much, because it's a lining that normally acts well. So the chief causer of ulcer, there is a bacteria we call Helicobacter pylori, which we normally say H. pylori. It's normally dominant in the stomach and the duodenum. Now, and also the acid content of the stomach and the digestive enzyme, which pepsin is a digestive enzyme that helps to digest protein. So they are the chief contributor that erodes the lining of both the gastric and the duodenum and now form what we call an ulcer. So anytime you now eat a food that is spicy or acidic, once it landed on that stomach, it irritates a patient. The patient feel pain. Normally, patient present to the hospital by mostly epigastric pain. Some will come with vomiting. Some will come with abdominal bloodness. And whenever you palpate, you feel some tenderness on the part of the epigastric. So, and also, it goes down to also stress can causes that. So those are risk factors. Smoking is a risk factor. Alcohol is a risk factor because this increase the acidic content in the stomach. Thought once there is more release of acid, and it does not is not countered by the mucosal layer because it's no longer there. That means the ulcer will not heal. So stress in what we do increase the gastric acid. Likewise, the food, some spicy food and acidic food that we take, and also basically, I think these are the few things that can prepare risk factors, and also some certain medications. Some we call NSAIDs. Those are non-steroid anti-inflammatory drugs that we take. We always buy them over the counter. Constant taking of those drugs without prescriptions, without recommendation, because you feel stomach pain, you just rush and get a painkiller. Once you do it constantly, those also aid in the eroding part of those gastric mucosa. And also, apart from the two major duodenal and gastric ulcer that is normally that people are conversant with,
Yes.
we have what we call esophageal ulcer. That's why I tell you is a wound that can happen along the line of the digestive tract. So, and we also have what we call jejunal ulcer. But mostly is when you have a bypass surgery,
Okay.
whereby the jejunum, which is the middle part of the small intestine, is anastomosed with the stomach. Now the jejunum is no longer in place because the jejunum don't have the mucosal layer of the duodenum. So there will be increase of the lining of the jejunum to erode.
Okay.
So basically, that is the foundational aspect of, I think, what we are about to discuss.
Okay, so guys, you have heard that he has given you a broad spectrum. He has, told you basic factors, and I think most of the factors that are being listed are daily lifestyle of people around, because some people see it as normal lifestyle to, go out with their friends and drink every day. But do you know that it can actually cause you ulcer, because this is at our detriment? And some people that also smoke, and I think I've heard of this where they say it when you don't eat properly. There is this I don't know if it's a misconception or something, but they say when you don't eat properly, you are at a high risk of ulcer. Maybe when you skip like meals very, very often. Is that true?
Yes, to some extent, some part of the statement, because the parietal cells of the stomach secrete acid, and normally in basic chemistry, acid is only neutralized by a base.
Yes.
So what the mucosal lining in the gastric and the duodenum do, once the acid is secreted, the pepsin and the digestive enzymes that aid in the digestion of the food that we eat, because they are corrosive, once they are secreted, if there is nothing to neutralize them, they cause ulcer. So sometimes, if you delay in your own eating, once those acids are secreted, they don't have anything to neutralize them. They tend to eat more of the lining of the stomach. So delaying food, eat food whenever you feel like you are hungry. But that doesn't mean, I have already underlined the fact that food doesn't cause ulcer. It's only spicy or acidic food that triggers or aggravate the symptoms of the ulcer. Likewise, you can know that there are some food. Some people have ulcer that if they take food, it causes them more pain.
Yes.
That is a classical sign of a gastric ulcer, because already the wound is here. But duodenal ulcer, if you have it, mostly it's being relieved by eating. So you can now see where the complications, the misconception, if you are not properly guided, you will really miss it. So
Okay, so you guys have heard it. He has said a whole lot about ulcer today, and I think that this could be able to clarify on the misconceptions about food causing ulcer, and also give you a highlight on how your lifestyle should be, because I believe it's never too late if you have the habit of maybe drinking or smoking. And also, if you have these symptoms, if you've had the burn, if you've had the pain, you will know that it is not a death sentence. It is really, really painful, actually. It is very painful, but you should know that this is not a death sentence. You can always go to the hospital, always consult your doctor, and you can always give us a call so that you can discuss with us, and then we can, let you know what you want to hear. We would educate you, because like I said, it's not always about the lifestyle, it's not always about the gist and vibes. Sometimes you need to be educated properly and from the right source, right? So this has to come from the right source so that we ensure that even though our listeners are always vibing, you have hectic Mondays, and then you are also educated on basic things, because you never know. This might save a life.
Yeah.
Okay, we went on a short break, but then we are back. So some people will want to ask, what are the things I can do if I have ulcer? Does ulcer heal? This is a very, very wide question that I've heard. Does ulcer heal? And I personally think, because this is a wound, this is an open wound, of course it will heal, but not instantly. Of course, right? It would
it's not
just not
instant.
heal instantly. So what are like the countermeasures, talking about lifestyle? What are the things they should do? What are the things they should not do? To control, also to put it under very minimal, you know, the space range,
Yeah.
so that they don't have to go out every day and then they're having the pain in their stomach region, because I think a lot of people neglect their health, which is actually very, very bad. There's this very crazy conception of sickness doesn't kill Nigerians or Africans.
Yeah.
Of course, we have very good immune health, but that does not mean that you neglect your health. That is not a certificate or a bypass to ignore signs that your body is telling you, oh, I need help, I need to be checked. Because believe it or not, no matter how strong you are, even the people who are genotyped AA still fall sick.
Yeah.
They still do
That's
fall
right.
sick.
That's right.
And nobody's exempted, actually. Nobody is actually exempted. So now, Nurse Andrew here is going to tell us, what you can do, foods you can eat to help you promote healing, because this is a major part. It's not always about the medication. Because, like you said, there are over-the-counter drugs that a lot of people use that will, cause ulcer, or cause maybe detriment to other organs of our body that we might not know, because we are always bent on, if you have one headache, you go to like a painkiller. If you have this on, you're feeling a little uncomfortable, you go to a painkiller. But that is not always the case. I believe in health, I believe in nature, and I think there are a lot of things that we can actually do to have a healthier lifestyle without actually relying so much on the medicines. What do you have to say, sir?
Okay. Basically, we are talking of prevention
Yes.
and treatment. That means looking at the outlook of an ulcer or the prognosis, whether it heals well. Well, the prevention aspect mostly is we advise people should go for routine medical checkup. Because normally, if you come, most of those symptoms are not easily noticed on time. But there is a simple test that we call a breath test. You can do it to now signify whether the presence of the H. pylori is rapidly growing up to cause more danger to you. So, in that aspect, you are going more on prevention. Now, lifestyle is very, very important, because we say stress can increase the acidic level. Alcohol, we have to reduce the rate of we consume alcohol, because it increases the acidic content of the stomach. You cannot be, okay, let's just say if you have been placed on drugs and you are still going back to the same lifestyle that caused the ulcer. It's more of saying is an issue that will not correlate. So what triggers the symptoms? You have to avoid them. You'll be guided on the nature of food you are going to eat and what you're supposed to avoid.
Okay.
Mostly we see smoking, alcohol, caffeinated drinks, carbonated drinks.
Okay.
They have more gastric content. So we have to reduce them to a bearable minimum that we can tolerate, that the system can tolerate. Because as I told you, the mucosal lining is very tough. It takes a longer time to erode. But once it's eroded, the prognosis, the outlook, it heals over time, after a while. But most times, once it heals, people go back to the same lifestyle that triggers the ulcer entirely. Now, mostly in the treatment, because of the complications that comes with ulcer, people don't really, you look at ulcer as if it's a joke. On a very serious aspect, if you have a gastric ulcer, one, because if you eat food, it causes more pain. Now you'll be afraid to eat. Now what are you saying? Hunger, hypoglycemia is setting in. On that process now, the person can end up collapse. Because once you don't have enough glucose, which is food, because the food that you take in, we term it as glucose. If the cells don't have anything to capitalize, there won't be much strength to. And also, that gastric ulcer causes vomiting for some people. So the fact that it has all these signs and symptoms, we're supposed to be careful of how we handle what we eat so that we not precipitate the symptoms, and also we don't cause more harm. Because if it goes to the point that you now come to what we call hemoptysis, that's vomiting of blood, or you're stooling with blood, melanin, also this is showing you are going to have more complication if you are not careful. Because the stomach, once it's bleeding, gastrointestinal bleeding is a complication of gastric ulcer.
Okay.
Yes, what does it cause? Because once you are losing blood, you lead to what we call deficiency, iron deficiency anemia.
Okay.
And it's also a trigger sign to health workers that may likely do an endoscopy to rule out cancer, gastric cancer, because gastric cancer come with signs and symptoms that looks like gastric ulcer.
Okay.
So you now see gastric bleeding that you think is a joke can lead to gastric cancer, but it has to be diagnosed. So if you come, normally, health talk, go to the hospital, get your healthcare provider, sit, discuss your lifestyle changes, apply it, and I think we are good to go. But the outlook, ulcer normally heals over a time after a while. But the chronic ones take a longer therapy, because once it's chronic, it can lead to not the gastrointestinal bleeding, it can lead to gastrointestinal perforation and what we call pyloric stenosis. I can still expatiate that more, but those are some of the complications, major complications that you can get with both gastric and duodenal ulcer.
Okay,
Yeah.
so you have actually spoken a lot. This is a lot of insight because you have, been able to clarify us that ulcer is not a death sentence
Yeah, it's
to
not.
people that have it, although it might have a lot of complications. And if you're listening out there, if you have had any of the symptoms, even if it's minor or it's major, please do not ignore it. You can always go to the hospital. You can, abstain from over-the-counter meds because this
Yeah.
can also trigger a lot of things that we do not want. And you can always call us, please. You can call us so that we will have a very, very interactive session on 090-9705-4405. Call us and let us know what your question is on ulcer today, and we will be able to clarify you. Because if what has come to my, what I have noticed is that a lot of people do not really want to engage when it comes to health until it gets very, very complicated.
Yeah.
I mean, of course, you can hear that it can also migrate into cancer, but that
Yeah.
does not mean that this is, a certain way, because like he said, there are similarities in, the symptoms. So if you have any symptoms, some people might just wake up at night and they say they have that burning sensation, which is something that everybody usually uses to like
With the
identify
gastric
ulcer.
pain.
Oh, I have that burning sensation.
And it's radiating to my back.
Oh, to my back, yes.
Yeah.
That's what most people do. And funny thing is that still they don't. It's not about, like, of course it's going to be expensive sometimes, but I think it's worth it when
Yeah.
it comes to your health.
Yeah, it's worth
Because there are a lot of people that will go to the hospital, oh, I just want to check this, and then they discover something else that has been hidden under your body for a while, because your body is more like an incubator. And a lot of things can be harbored inside. And because your body wants to fight them out, it will take longer. Like, it will take maybe 6 months or maybe even longer for the symptoms to even come out. And at that point, it might have caused maybe a damage, right?
Yeah,
It
yeah.
might have caused some irreversible damages that we do not want. So you can call us, like I said, 090-9705-4450, or you can call us on 090-7353-0044. So yes, everyone, if you're listening to us, remember, checking your health every 6 months. Yeah, it's every 6 months, right?
Yeah.
Every 6 months going to the hospital. It is very, very important, because there are people who have come in and be like, oh, I just want to check something, and they discover their sugar level is high.
Yeah.
Or they're hypertensive. And funny thing is that you never know what is going to happen. We're not saying anything, bad will happen, but at the same time, you don't know exactly what could happen. There are people who have passed out behind their, driving wheels, behind the steering. Okay, we have a call. Hello? Okay. Please call us back. You can call us back. I think we have a little bit of internet issue here, but you can call back on 090-9705-4405. So, like I was saying, it is not a death sentence. If you have, the symptoms, please endeavor to go to the hospital. Hello? 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 Oh, wow. We have really, really bad internet. Okay, we have really bad internet, but like we were saying, please call us, and you can always ask your questions. You can, always, there is knowledge for everybody. I think it's it's very big, and you never know, this might be a lifesaver for you, because your siblings, your kids, anybody might have had this symptom and then they ignore it. And then because you have the information right now, you have the knowledge, which is very, very powerful. Knowledge is a very powerful thing. And because you have this knowledge, you might be able to save a life out there. So, Mr. Andrew, what would you say to people who have already developed certain kinds of, chronic symptoms that do not know what to do at this point?
Okay, at this point, chronic ulcer diseases can be managed, but it has to be on long-term basis. Like we said, medication can manage them. Some can go to an extent of going for surgeries because of the complications, because the chronic aspects of gastric and duodenal ulcer can lead to what we call surgical interventions. Surgical can be more of an laparoscopic surgeries,
Okay.
or pin or keyhole surgeries. Yeah. So the chronic aspects of the diseases is manageable, but it has to be on long term. Long term has to be in that aspect. It has to be a multi factorial approach that they have to, where you have to bring in the dietitian, the nurses, the doctors, and the gastroenterologists, so that they now have a holistic approach to give you the best, because each part of those professional has a role to play in managing the chronic aspects of it. Because the dietitian will place you on a very fantastic diet. That's the more reason people need to come to the hospital to get information. Sometimes you don't need to be sick to be down. Mostly this aspect in this part of the continent, the African part, men are the culprits. Because before you see a man on a bed, it has really weighed him down.
Okay, I think we have a call coming in. Hello? Hello? Oh, wow. This is really, really sad. But we also have a question here.
Okay.
Can ulcer cause palpitation?
Palpitation does increase heartbeats.
Yes. Can ulcer cause palpitation?
It depends on how you get the information. Because if you have the wrong information, itself can cause palpitation.
Okay.
Yeah. So, because people take so many, let me go to the African part of life. People believe ulcer, if you take native medicine, you can hit on it and it will go. Even the native medicine guys can tell you they will have a drug that can cure 7 illnesses or more. But let's not be fooled, people. Ulcer, based on the information, can actually cause palpitation.
Okay.
Because if you see somebody vomiting blood in the hospital and they say it's ulcer that caused it, for you merely seeing that scene and how bad the patient presents, and maybe you're opportune and you begin to have the symptoms because of the interconnectivities of the system, definitely cortisol, the cortisol in your body reacts. It's like saying you break an information to a patient that is having a viral infection. Such an information can cause so many cascades of things that can go in on the body cells. Now, because the information that you have gotten is not properly managed, it's not properly given to you, there was no much counseling, no much information. The information was just like, for instance, if you come to a hospital, before they diagnose peptic ulcer diseases, you must undergo certain tests. You will do a stool test, you do a blood test,
Yeah.
you do a breath test, and you can also do a CT or gastrointestinal X-ray. But the gold standard for diagnosing ulcer is an upper endoscopy, where they put a camera through your mouth down through the esophagus. What that endoscopy do, it does 3 things to you. 1, it diagnoses the ulcer. 2, medication can be served to coat, that means to coat the eroded part of the mucosa. And lastly, they can take a sample, they can take a biopsy to rule out that your ulcer is not cancer.
Okay.
So, like I told you, some gastric ulcer can cause cancer. This information alone can make somebody to have palpitation.
Okay. Because this is
yeah,
very scary.
Yeah, it's scary. But that's the truth until it has been ruled out. Because once you are stooling and coughing out blood, that will say it will result to what we call iron deficiency anemia. And it's also a trigger. It will give you a loophole to the point that you may have to do a biopsy to rule out gastric cancer.
Okay.
Yeah, so that alone can cause palpitation.
Okay, guys, this has been a very, very, very interactive session with you guys, and we are actually so honored. We are so happy to have you on the show because this is a lot of information. So, listen, guys, like I said before, ulcer is not a death sentence. right? Even if you have like, the blood and in your stool and everything, it is not a reason to be scared. I think the most effective thing and first thing to be done is consult a very, very licensed practitioner, because some people out there are not properly licensed.
Yeah.
You should know that.
Yeah.
So to endeavor that your health is on check so that you can keep up with us, we want you here every time, regardless. So as much as I want to stay here, we have to round up so that we do not spill into other parts of the show. So let me use this opportunity to actually thank Nurse Andrew here for making out time to come here for this very, very educative session with us. Thank you so much, guys. Thank you so much, Nurse Andrew. And for other questions that we could not answer to, we are very